Amazing. All right, we are recording. All right, so thanks everyone. I see more and more people joining us. Thank you so much for being here with us tonight for Mental Health Voters Matter, a policy panel discussion. We are really happy to have you all joining us for this really important discussion hosted by NAMI-NYC, the National Alliance for Mental Illness of New York City. I'm going to be turning it over very shortly to our wonderful moderator, Jamil. But until then, feel free to just sit tight, keep yourselves muted. I'm going to make sure to keep everyone muted just to make sure we're not having any background noise. But you will have the opportunity to unmute yourself and ask any questions that come up later on in the event. So we'll give it just one more minute and then we'll get started. Feel free, please feel free to say hello and introduce yourself in the chat. Say where you're joining from. We'd love to have you say hello.
Hi, I'm William.
Awesome. Hi.
Currently calling from my bedroom in a New York City apartment. So that's
New
about
York City. Awesome. All right, so I think with that, hello, Larry from DC. Hey, Larry, Zamora from California. Jessica from California, couple of NYC folks, Boogie Down Bronx, love it. Upstate New York, really glad that we're having folks from all over. So I think this will be a really good discussion.
Yeah, I think so too.
All right, so with that, I think we're gonna see if we can get started. Yeah, this event, as I said, is hosted by NAMI-NYC, the National Alliance on Mental Illness of New York City. We are a grassroots mental health organization dedicated to providing support, education, and advocacy for all individuals and families impacted by mental illness. We provide free support groups and classes and other services like this event through Zoom. Currently, our offices are closed, but we are providing everything that we can remotely through Zoom and through phone. So we are really grateful to everyone for joining us in this virtual event. If you'd like to find out more about our services, please do visit NAMI-NYC.org. You can also call our helpline, 212-684-3264, or email helpline@NAMI-NYC.org. And I'm going to put that information in the chat as well. If you have any follow-up questions, you want to know more, we have free classes and support groups and many other services to help you stay connected, even during this time when connection is a little bit more difficult. And we also have a lot of really cool advocacy initiatives. So if you are interested in getting involved with that, please do check out our website as well. So with that, I'm going to turn it over to Jamil, our moderator for the evening.
Thanks so much, Clara. Hi, everyone. My name is Jamil, and I will be moderating this event. Thank you so much for joining us tonight for Mental Health Voters Matters. As I'm sure you all know, November 3rd, 2020 is Election Day, but hopefully you've already taken advantage of early voting to make sure that your voice is heard. Now more than ever, we need elected officials who support families and individuals impacted by mental illness, and voting is a really important part of making that happen. We need elected officials to care about mental health because 1 in 5 Americans are living with a mental illness. Think about that. That's a very large constituency. So we need our politicians and policymakers to care about these folks. Something that I love that is often said at NAMI is 1 in 5 Americans are living with a mental illness. The other 4 are brothers, sisters, roommates, classmates, coworkers that you see on Zoom, you know. So really, this is something that impacts all of us because mental health is something that all of us have. So today you'll be hearing from some folks who know firsthand about the intersection of mental health and education, criminal justice, healthcare, and education, other really intersectional issues. Because like I said, because mental health is something that all of us have, ultimately mental health is a policy issue, as an issue that's embedded in almost every policy issue. So today we'll be hearing from Matt, Irving, Daris, and Kiely. I'm going to let them introduce themselves because they're really great, and I just want to let them have as much time as possible to talk. So let's have our panelists introduce themselves. So please take yourself off mute. And when you're introducing yourself, please, and my name is Jamil. I use he/him pronouns. When you're introducing yourself, please say your preferred pronouns, who you are, what you do, and why is mental health important to you. And we're going to start with Daris.
Hi, good evening, everyone, and thank you for having me, Jamil. So I am Daris. I'm an educator, I'm a community activist, and I'm also an advocacy ambassador with NAMI. You'll find me in my neighborhood. I'm also an educator, but I'm a retired educator. So you'll find me in my neighborhood designing beautification projects, often advocating for food justice programs, and also working with NAMI. I do this because I feel like everyone is connected, and I have a family member that I love dearly who is living with a serious mental illness. And I just want, because we are so connected, I just want to do whatever I can to speak up when that person can't speak up. And also for anyone in my community, I like to speak up for them as well, especially around ideas of mental illness and what our officials are doing to support people living with mental illness in the community. Thank you.
Excellent. Thank you so much. Appreciate it. Katie, you're up next, please.
Hi, everyone. Thank you so much for being here. And thank you, Jamil and NAMI, for having me. My name is Katie Loeb. I use she, her pronouns. I work for New York City Councilwoman Carlina Rivera, and I'm her budget director. And I also do a lot of constituent services in the office. And one of the reasons why mental health issues are so important is because we see in our office the way they intersect with almost every single policy, from housing to food access to public spaces. And so, in our office, we do two things really, especially from a city local level. We do policy, like broader policy. How can we build mental health services into the way the city operates? And then the second is a provision of service or constituent services, where we really meet people where they are and they're dealing with mental health issues. And we see the way that this impacts their lives in multiple different ways, and try to build policies that will address that and provide services that can meet their needs.
Excellent. Thanks so much, Katie. And I see that Daris dropped in. Her pronouns are, she uses she, her pronouns. Thank you so much. Appreciate it. All right, Irving, you're up next.
Yes, good evening. My name is Irving Campbell. My pronoun will be he or him. I am a registered nurse at New York Presbyterian Brooklyn Methodist Hospital. I'm also one of the senior delegates at the New York State Nurses Association, and most recently have graduated from school and now can proudly call myself a psychiatric mental health nurse practitioner. This issue is so important to me because unfortunately, COVID came and actually showed that there needs to be more access to mental health. And instead of providing more, we're seeing that it's creating less access for our patients. And I think now more than ever, as we come along this election year, but also 2021 being a huge year in New York State and states across our country, it is more important now than ever that we talk about mental health and mental illness and fix the issues that are really at our feet right now. So I look forward to this wonderful opportunity and helping you guys and you guys helping us, help each other. Thank you.
Excellent. Thank you so much, Irving. And last but certainly not least, Matt Shapiro.
Thank you, Jamil. As Jamil said, my name is Matthew Shapiro. I use he or him. I'm thrilled to be here tonight. I'm the Associate Director of Public Affairs for NAMI New York State, the state organization. So join you up from Albany. and I'm just like thrilled to be here with such a great panel. I mean, I've got to advocate alongside Daris before. We were in Queensbridge together. I've advocated alongside Jamil. Irving is such a rock star. We had him on the Perspective show to talk about this very important issue about bed closures. I know he's going to talk about that. I'll talk about what's kind of going on in the private sector right now. And thank you, Katie, for taking the time to join us too. It's so great to see when we have these type of relationships with our elected officials where they can join us. So mental health is important to me for all the reasons my colleagues have said. To me, mental health is everything. Me personally, I've been battling mental health issues since I was first diagnosed at 3.5 years old with ADHD. These days it's more anxiety, depression, but we deal with what we deal with. I have family members with a mental illness, including my mom who has borderline personality disorder. So these issues are very important to me, and making sure we have access to appropriate mental health services are really important. And so we'll talk a little bit how they're threatened. I also want to apologize from the outset that I'm a little pressed for time. We're in the midst of planning our big education conference. I actually have to do another recording a little after 7. So I will put I feel bad I won't be able to answer questions, but I'll put my email in the chat. Anyone's always free to email me. I'm also going to put some more conference information in there too, because we are going to be doing an Act and Vote for Mental Health session on Friday afternoon, where kind of what I'm going to talk about today is like a Cliff Notes version, but we'll really dig deeper Friday afternoon at the conference. So I'll put a link into that as well.
Awesome. Thanks so much for joining us, Matt. I really appreciate it. And since, you're heading out, since you'll have to head out a little bit early, and I think that's we have you right now anyway, I'd love to hear what are some of the big policy issues that NAMI-New York State is focusing on right now?
Sure, of course, it's obviously the biggest question. I mean, right now, everything, if we were having this conversation in March and we were still in the middle of the advocacy session, I would talk to you about all the legislation we were working on, including the Coles Law, which is the first bill that we've authored, we wrote the bill, which would improve on suicide, hospital practices and dismissal practice or discharge practices for people who have had repeated suicide attempts or drug overdoses. So that was something we were very excited about. We were making a lot of headway with that. And again, the NAMI New York City ambassadors, Jamil and Daris, and I think I saw a couple of the others on there, did such a great job during our legislative action day. We got a lot of new sponsors for the bill, but then things got a little derailed with COVID, or a lot derailed. So, COVID's had a huge impact on mental health, not just the collective mental health of our society. And, I think we're really going to be seeing a tidal wave of people seeking out mental health support. When I talk to our colleagues at the Office of Mental Health who run the new free support line that they set up during COVID, they said that so many people are calling the line and seeking out mental health services for the first time in their lives. So that's a very encouraging thing to hear that people are seeking help. But what's more scary and really concerning is the help going to be there to meet this tidal wave of need? So, I mean, we know that people are facing anxiety and depression at levels they've never faced before because of, the three-headed monster of our time, COVID, the racial injustice issues, and the economy. So, we know people are upset and going to be seeking out mental health services, but other services going to be there the way we're accustomed to. Now, anyone who's heard me speak before has heard me say there are not enough services to begin with. I've been saying this for a really long time, and now things are getting even a little murkier. So I know Irving's going to talk about the bed situation, what's going on with our psychiatric inpatient beds, just really quick, the Governor Cuomo, and justifiably so when he did it. Let me say that, back when we were at the height of the COVID outbreak, mandated that 30% of hospital beds be available all across the state in case of another COVID surge. The idea was if things continue to be bad in New York City, they can bring people to hospitals upstate where, the capacity might not be as bad. So every hospital had to have 30% of their beds, designated to be available for COVID. Hospitals disproportionately focused on mental health and substance use beds, detox beds, to meet that mandate. I know Irving's going to talk about the impact that's had, and a lot of these beds have been targeted for a really long time because they're the least profitable type of beds, because of the way the Medicaid rates reimburse, and because hospitals profit most when they have kind of a revolving door of patients, very acute care stays, surgical stays, 1 or 2 nights, maternity, things like that, where you can flip the people over. Long inpatient stays are not profitable for hospitals. And we talk a lot about access and parity, and we know that Medicaid rates aren't reimbursed the same way. So that's a really big concern for us, the hospital issues. And it's been such an honor working alongside Irving and his colleagues at the New York State Nurses Association. The stories he has to tell are heartbreaking and scary. And it's so encouraging to see, mental health providers who really care about the people they've served for and are on the ground fighting for them. So Irving, big hats off to you, brother. Much respect. But in the community setting, the situation is just as bad. We know New York State right now has got serious budget issues. One of the ways that's manifesting itself is that any community provider, any human services organization that has a state contract is right now currently having 20% of their budget withheld. It's not a permanent cut. It's a little different than a cut. Basically, what they're saying, if I owe Jamil $10, right now I'm only going to give Jamil $8. Maybe down the line, I'll give him his 10 again, but right now he has to accept the 8 that I'm giving him. And that's indefinitely. And we're worried that those cuts might become permanent. So we know too that a lot of mental health providers, especially mental health housing providers, have been grossly unfunded for a really long time. Anyways, action alerts. This is something we talk about all the time, that what a mental health provider, the amount of money they get per client is almost criminal, and it's only going to get worse now that they're operating at 80% of their budgets. And again, they were really kind of doing it hand to mouth to begin with, so to speak. So that's something we're really concerned about. So we're fighting, either to get more federal funding in for states relief. We're looking at different revenue raiser options that might be used to help our budget situation. But the bottom line is, we know mental health services are going to be needed at a level they've never been needed before. We need all of your voices to make sure those services are there, and explaining how you've benefited or how your loved ones have benefited from community providers or from a hospital bed if they've needed it, and how valuable these services are. And we need you guys to put a face on these services and save what we have, because it's a very perilous situation, and we need every voice that we can. We're going to be doing a lot of trainings from the state level on this. Again, I put the conference link in the chat. Even if you're really interested, you can just come for that Friday afternoon session on Act and Vote for Mental Health. I'm going to be going into this a lot more and how you can make your voice heard. So thank you.
Thank you so much for that, Matt. That was great. I think that answered a lot of different questions. I really, really appreciate that. Especially
probably raised a few too. I apologize about that.
That's fine. No, I thought it was very helpful. A very great overview. And it was also, I thought, really helpful how you explain, you discussed how COVID impacted, this legislative work, how there was a lot of momentum happening. And now COVID, not only was there a need to pivot to, respond to COVID, but there's also been some aftershocks, so part of the advocacy work and part of what we need elected officials, I think, to know is it's really important to remember mental health as a part of the COVID-19 response plan.
And like what we say is that we can't move forward without mental health being addressed. There is no recovery without mental health recovery as well.
Absolutely. I love that. There is no recovery without mental health recovery. I think something we were saying at NAMI New York City is, public health, mental health is public health. And so if you're gonna address if you're gonna create a public health response plan, a public health recovery plan, you have to make sure that mental health is an important component of that. So thank you so much. It sounds like you guys are gonna be really busy, is what I'm hearing.
Yes, and again, I do want to thank you, for all your service to as your time with us is coming to an end. Hopefully, you'll be like my man Larry down there, and you might be leaving the job, but you're not leaving the NAMI family. So, I just want to say I've loved working with you. You're an incredible advocate, and it's been incredible, working alongside of you. But I want to, of course, thank all the colleagues that you have here at NAMI New York City. I know June's on there, Clara. You guys have really been on the front lines when things were so bad in New York City. You were the frontline workers for so many people, responding to, I know, a record amount of helpline calls and the support you're doing, the Black Lives Matter program that you started. We're just so grateful for all the work that NAMI New York City is doing to really meet the needs of people during these difficult times. And again, Jamil, thank you for all you've done over the years as well for us.
Thank you so much, Matt. I've really, working with you has been incredible. I've learned so much while working with you, getting to see your advocacy. And yeah, I got to work with such an incredible team. It was incredible, yeah. So thank you very much. I really appreciated it. And I hope that everyone, Matt put the conference link in the chat. So please get, if you get a chance to click it, check it out, register.
Registration is free too. I should have said that, and I won't interrupt you again.
Look at that, free. Like now back in the old days when COVID happened, they could charge you because you had to go to a hotel. But now it's like, I'm in my house. You can't make me pay for this. So yeah, take advantage of this, guys, if you can. Thanks so much, Matt. Really appreciate that. Keeping, kind of continuing thinking about our mental health system, I want to turn to an advocacy. I want to talk to Daris. Daris, who is a community activist, an educator, an advocacy ambassador, and a family member. NAMI New York City, it was made for family members and individuals who are living with mental illness. I think, Daris, you're really great, a really important part of the family component of that. So as a community activist and family member of someone living with mental illness, what are some of the problems that you're seeing with our current mental health system?
Right. So if I look at it as a timeline, I've seen my family member from child to adult, and there was always a space to fall through the cracks, always falling through the cracks during times of transition. So I would say, like, moving from high school to maybe a day program, there were always wraparound services offered, but they didn't always wrap around. And I even see that today. Wraparound services were offered recently, and that sort of fell through the cracks. And even with someone like myself, constantly calling and checking and begging for support with that, he still fell through the cracks, to the point where now we're talking about ending up in the criminal justice system, right? So, and a problem is, and I would like to know, why is it that now more than ever, when people with serious mental illness or mental illness go to the hospital, if something goes wrong, the police are being called so much more now? And so then it turns into like a criminal justice issue, right? And even if a person goes through that system and now they're released, that's another problem. They're released with a bottle of medication and saying, go to this shelter. So I was looking for my family member, and he had already gone to 3 shelters. Nobody could tell me where he was. By the time I found him, he had already decompensated and now is facing the court system again. So these are some of the problems that happen all the time. And I don't understand, it's like, it's just too much room to fall through the cracks, even when the people have somebody supporting them and wanting to know. There's a lot of red tape with finding out about your family member, getting information due to privacy reasons, I understand, but I'm also a guardian. And so there was no reason for, me to lose track of him because I'm the legal guardian. I went to court to become the guardian, but I still couldn't get information. And so while we were promised wraparound services coming out of Rikers, it would be like 3 weeks before they actually saw him. I mean, I was the wraparound service. So I was checking in and trying to keep up as much as I could, but somehow I lost him. And I don't know if you can imagine what that feels like, not knowing, because people are very vulnerable and you just don't know, you know, what happened to them. And finally, I get a call that he's back in the criminal justice system again. And then that becomes really difficult as well, because why, my other question is, why is it that some people are handpicked to go to the mental health court while others are not, right? So my family member, having been born with a mental illness, has never seen the inside of the mental health court. It's always straight to the hard time, you know. So those are some of the things that we deal with all the time. And even with people having a support system, they still seem to fall through the cracks. And I would like to see, you know, I would like to have some of those questions answered and see how we could really amend those things.
Thank you so much for sharing that, Daris, for sharing, you know, not only your experience, the experience of, you know, your son as well, and really for laying out, you know, how clearly the system is really failing with the access to, you know, the access to wraparound services. Like Matt says, there's not enough services, right? Not enough funding. So, you know, there's so many areas where we could see if there had been an intervention, you know, something could have been different, whether it's the wraparound services or, you know, connecting your son, you know, making sure that someone calls you and your son was able to get out, or like you mentioned, the mental health court. You know, something that NAMI-New-York City and I know NAMI-New-York State's been looking into is how can we make, you know, how can we fund these mental health courts more so that more folks are able to see them? Because we absolutely know not only is it, you know, a lack of access to mental health courts, but of course there's a racial disparity. You know, when you mentioned that, you know, why do some people get to see the inside and not? Well, you know, we know one fact that I learned when I came to NAMI, which was really interesting, is that Black men are more likely to get diagnosed with schizophrenia than white men, because schizophrenia is seen as more of an aggressive disease and Black people are more aggressive. So it's just stigma on top of stigma on top of stigma. So yeah, I think that you laid out a lot of good, or a lot of not good, a lot of issues rather, a lot of very challenging issues.
Right.
Yeah, sorry, go ahead.
Had to live through them. Something is coming up for me, but I lost it, but I will get back to you and let you know. It was a question that I had. Oh, I think it was to do with the hospital situation. I think I mentioned it, but I want to know how prepared is the hospital to deal with people who come in having an episode. Like if you go to the hospital to get help, how is it that you're leaving in the police car or getting arrested on the scene? Like, I don't understand that. And okay, maybe something happened. However, if you have somebody coming in with maybe paranoia, are you prepared? Is the team prepared to deal with approaching people who have paranoia and things that would make them, you know, get upset? So that's another question that I'm looking for answers to. Why?
I can answer that really quickly before I jump off. So
Okay.
there's a lot to unpack there.
Yeah.
Simple answer to your question, no. Hospitals, you take your loved one, or if your loved one gets intertangled in the criminal justice system and you have to call first responder, be it police, EMS, whatever it might be, and they take them to the emergency room, we know that's like the worst place to bring someone when they're in a mental health crisis, is the emergency room. And I'm sure Irving can talk a lot better about this in the hospital system as a whole, why we need specifically psychiatric emergency rooms, because emergency rooms aren't designed for psychiatric care. They're designed to save lives, right? So, and they're triage, right? So you're gonna get in the back of the line, behind people who are having heart attacks, have been shot, have been, life-threatening things where, mental health issues aren't considered life or death and that type of triage situation. So we've heard the nightmare stories of people are brought in during, a psychotic episode or a massively depressive episode where they're detached from reality, and they're stuck waiting in a emergency room for up to 3 days, 4 days, 5 days, seeing very traumatic things, which is only making their situation worse, and they decompensate. Now, many times too, if the police officer is the person that brings your loved one to the ER, they have to stay there with them, and they're not going to stay there 72 or 72 hours. So if they decide to leave, your loved one's coming with them. So, you know, and please to somewhat understand this too, that they've learned that bringing them to an ER isn't the best place, and arresting them ideally isn't the best place. But again, when we don't have enough services available, what are the other options? It's not just, you know, we need more hospital beds. It's things like respite centers, crisis centers, acute care, where we can get somebody stabilized during that critical period of when they're really sick, when that onset. Let them get over there and then take the next steps and deal with their legal issues. So I hope that somewhat answered your trickier question. And one thing too, I put it in the chat box, when you talk about the criminal justice system, we need to do better enforcing the laws when people are coming out of corrections with a mental illness. Their Medicaid's supposed to be turned back on 30 days prior to discharge. They're supposed to get at least 30 days worth of their medication coming out of discharge, but they're not set up with services. That's what doesn't make any sense. They say, here, your Medicaid's turned on, here's a month's worth of medication, good luck to you. And we know that's not the best way to deal with things. That's why part of the reason we see such recidivism rates is that we're not setting people up to succeed coming out of jail. We're setting them up to fail. And that's everybody, but especially people living with a mental health issue.
That's right. Yeah, thank you for that info.
Oh, of course, and thank you for all you do, Daris.
Thank you, Matt. I really appreciate that answer. That was very helpful. Thank you so much, Daris. My next question is for Irving, because I think we've been talking a lot about, you know, psych units and what's happening with them. So my question for Irving is, we had a really good conversation where I think you and I discussed a lot of the good things that were happening in your psych unit. So I'd really love to, you know, if you could talk about how your psychiatric unit, you know, where do you work at? You know, how is your psych unit successful in helping patients before COVID-19? And then how has COVID-19 impacted your psych unit and other psych units? And as a NISNA nurse, I think you're in a great position to explain this.
Yes, most definitely. In terms of prior to COVID, our unit was very successful in helping people get access to care, continuation of care, I would say, setting them up with post-discharge connection to therapy or psychiatrists or, you know, psychiatric mental health providers. In terms, I always fall to this one story that I think it's very important that I say it, because you'll see prior COVID, post-COVID. I had a 27-year-old young woman who had committed a suicidal attempt. She suffers from depression. She came into us year 2018 or so, late 2018. She was very despondent, wanted to end her life. She stayed with us for 41 days. She stayed with us for 41 days and became pretty much like another nurse on the unit, another staff member. We provided her with care that she needed. We supported her family in terms of emotional support, giving them resources that they could use once our patient had left. She was discharged and returned to us a year later, but not as a patient, but just to come and thank us. The year after, she found a new job. You know, she found a new mate, and she was very happy about that. And she thanked us for pretty much saving her life at her most lowest point. That was probably the most rewarding or fulfilling thing that I think I've ever felt in my career. And this is going on 20 years. So that is the highlight. Now, unfortunately, COVID had come and took across New York State or inpatient psychiatric units. And it feels, again, that across the board, it was just all inpatient psychiatric units. All of our units returned to normal in May, and our unit was the last to not reopen, and we're still not reopened. And it all boils down to money. It all boils down to the lack of reimbursement. But for me, in terms of the closures happen at Brooklyn Methodist. The closures happening at NYP Allen. It's happening in Hudson Valley. It's happening at Northwest Syosset. It's happening in HHC, where they closed on all their detox units prior to COVID. And now we're seeing the effects. One story I'll share with you in terms of patients that I know. This pandemic created such a void in our community. I have a patient of mine who has been coming to us for almost 8 years now. He is a former engineer. He's a person who lives in the community. He comes to us at least 4 to 5 times for the year. I saw this gentleman going through the garbage on 7th Avenue near Brooklyn Methodist Hospital. I pulled over and I went to him and I said, hey, what's going on? He told me that he's come to the emergency room about 4 times in the past month at the point when I saw him. And he said, I was trying to get help. And every time I came, they told me that they wanted to ship me to Westchester. And I told him, I said, I understand, our unit is closed and I know that could be very difficult for you. But, as someone who genuinely cares about you, I would like to see you get the care, And I said, it's very important because you don't want to be in a situation where you're facing, like Daris said, you don't want to be facing the criminalization system. So his response to me was one that I've heard so many times. He told me he trusts us. We were like family to him. We helped him through his most difficult times and got him through probably the worst points in his life. He said another point is that his mother is his only level of support. She's 78 years old. They live in Park Slope. You talk about a 5-minute walk from their home to our hospital versus over an hour to get to Westchester. That is not providing community care. That is a recipe for disaster. It's setting up our patients and their support system for failure. And this is just one of many examples that I have. This really just highlights a lot of inequity in our system. So NYSNA has made the bold statement that we will stand up for our patients. We will fight every closure. We will, save New York Psych. I hope that hashtag Save NY Psych is going live and viral at this point. But we need more access to mental health care. We need more supporters. We need more providers. We need to support family members so that way that they can get the patient's help. They can get help themselves, because it's not easy living with a mental illness, but also we have to realize that family members are also in that bubble, if you will, right? So if there is no access to mental health care, how do our patients get the help that they so desperately need? And right now the impact is even felt even more so through the rest of our hospitals, where we're seeing our mental health patients being treated on non-behavioral mental health units. So they're in the med-surg units, they're in ICU units, they're in the ER coming in with suicidal ideations for 36, 37 hours. That to me creates a whole myriad of problems. Not being treated by professional trained to care for this population, I think creates an even more trauma for our patients. And it's something that we must, fight head on. And I will continue to do that, all that I can do for my patients, because it's certainly needed. And like I said, this year is important, but 2021 in New York State is going to be even bigger. So I just want to thank you again for this opportunity. Thanks.
Thank you so much for sharing that, Irving. I think that really illustrates how psychiatric units and inpatient units, what can go right with them, when someone feels like they're a family and feel trusted and, access to care. Then how COVID and what happens when you close them, right? Like folks don't feel comfortable going back they don't feel comfortable. They don't feel comfortable going to new places, especially if it's an hour away, to weigh in Westchester versus Brooklyn. So I think that, that story just really illustrated why it's so crucial that, we continue funding these units, that we understand that there's a lot of different types of care that folks need. And for folks that need inpatient care, it's very important that they can get that community-based quality, because it sounds like that's what you guys are giving, quality community care. So thank you so much for that. Really appreciate it. And like you said, also 2021 is huge in New York State. We're gonna have a lot going on, and in New York City, we're gonna have mayoral race, city council race. So it's democracy never ends in America. Woo, voting.
That's true.
All right. So our next we have Katie. Would love, Katie, would really love for you to talk about, as someone who works not on the other side, but someone who's coming, who works in as a staffer, who has that experience. I think it'd be really great to hear what are some common concerns that your office is hearing about, and how has COVID-19 impacted the type of mental health support that folks are asking for?
Yeah, it's impacted it hugely. And so from like the staffer perspective on constituent services, I want to get to that a little later because Carlina is actually the chair of the hospitals committee. So a lot of the stuff that Daris and Irving have been talking about are really at the forefront in our office. The really how the criminalization of mental health and how hospitals aren't safe for people in mental health emergencies, and how we can really improve our Psych-ER treatment is something that we're really looking into. Bellevue Hospital isn't in the district, but it's right across from us, and they have a Psych-ER, and we see a lot of problems there too. And it is to what Daris was speaking about, those gaps in the wraparound services. When somebody goes to a Psych-ER, they become stabilized and essentially released right away unless they agree to stay in, but there's no follow-up on what kind of other services they need. What kind of other casework. And I know Bellevue is actually working. They have a clinic a couple days a week that does wraparound services around mental health issues. So you come to the Psych-ER and you also have access to this clinic, and we'd love to see that expanded. And when it comes to funding, it costs a lot to put somebody through the criminal justice system, and it might cost a lot to provide quality healthcare, but we believe that that's a far better use of our money. And that is how we should be spending money, instead of just cycling people through Rikers Island and shelters. Investing in public health infrastructures that are mental health focused, that do provide these wraparound services as well as these direct mental health services, is a way that we can really address a lot of these systemic multi-generational issues. And to speak about what Daris was talking about with her son, my brother also has severe mental health issues, but he was never criminalized. And that is another aspect that we really do have to look at, is how are these biases becoming injected into our system? So we look at that from the policy perspective. That is, at the forefront, and anything that we can do to champion these initiatives, we do, whether it's by providing funding to H&H for some of these pilot programs, or whether providing funding to nonprofits through city council initiatives to really address a lot of these, these gaps in some of the city and state contracts, like the 20% withholding is trying to make up some of that with some council discretionary funding. And also really trying to influence the way that the Medicaid reimbursement works. Like there's not a ton of influence that we can have at the city level, but just trying to lobby our state colleagues and the governor and the Medicaid redesign team, because obviously the way that they're doing the reimbursements is only causing greater costs to hospitals, when reimbursing fully for mental health services would reduce a lot of costs and save a lot of money in the long run by just making that upfront investment. And then in terms of constituent services, we really do see the gamut. we have people coming into our office who are experiencing a mental health emergency. And then, we see everything from underlying issues and undiagnosed issues that are causing other impacts. And we see a huge intersection in housing with this. So one of the big policies that we really work on is supportive housing, where you have mental health services on site. And so you don't need to be going into a hospital and out of a hospital. You can have those services on site and other kind of community-based care where it can be integrated with these other wraparound services, and people can be met where they are. And since COVID-19, we've seen a huge impact in mental health, especially what we've seen sort of like underlying, low-lying anxiety, depression, people who are probably not being treated because they weren't being treated before COVID. And they're really exacerbating other issues. They're making it difficult for people to access benefits or file paperwork or renew their leases. And there's creating sort of like a generalized sense of like panic and anxiety. Something to what Matt was talking about is the amount of people who are going to need services and who do currently need services, and how we don't have enough providers. Our office is really interested in working on free social work programs through CUNY or through expanded scholarships. And in the past, we've supported with discretionary funding some of these culturally specific scholarships for the Latino social workers. People who don't speak English have an even harder time accessing these mental health services because we're not opening the doors to, recent immigrants or people who are multilingual or from different backgrounds to access mental health education and training to then be able to provide these services. So that's also something that we're very interested in exploring. We've also seen that from COVID, a lot of telehealth has become a barrier to actually providing mental health services because of the way insurance is reimbursing for it, is that the already low reimbursements have become even lower. So we've had a couple constituents come in and say like, hey, I was seeing a therapist on a regular basis. And when COVID first started, we were having these phone calls. It was super helpful, but my insurance refuses to cover it now. And so they're completely cut off in a time when we're already more anxious and we need those services even more. And we've seen the intersection in mental health and then other health provisions, specifically around maternal health care. At the beginning of the pandemic, a lot of hospitals said people couldn't come in with a partner or an advocate while they were giving birth. And that is a huge, huge impact on mental health and feeling secure and safe while going through a very extreme event. And so Carlina made sure that the hospitals changed their policy and are going to ensure that there's always going to be a spouse or partner or advocate available to people giving birth. And we also saw the way that mental health workers or healthcare workers had mental health impacts from the stress, the pressure, the grief of their positions. So in June, Carlina had a joint hearing with Councilmember Diana Ayala, who's the chair of the Mental Health and Disabilities Committee, about how when we're preparing for the next surge or any event like this, how are we putting our healthcare workers at the forefront and making sure that they are not absorbing too much pressure, too much mental health strain. And we heard about how H&H created mental health access for their workers. And we're working on kind of standardizing, scheduling so that people get breaks and can get access to mental health care while they're working and really going through, going above and beyond to serve the people.
Wow, thank you so much for that, Katie. I really appreciate that. It was great hearing about the issues that constituents are having, constituents and also other folks. Like you said, Councilmember Rivera chairs the health committee, health and hospitals, or just hospitals?
Just the hospitals committee. Okay. So she has oversight over the health and hospitals, the public health.
Right. Okay.
But Councilmember Levine is the health committee. So we work together on a lot of stuff. Well, what Carlina really ends up focusing on is the kind of the nuts and bolts, like what happens in the hospital, how do you receive care, how do hospitals administer it? So it's far more technical, but it is like really that provision of care.
Yeah, well, it sounds like, I mean, that example of making sure that, you know, you have a loved one, a partner, advocate when you're giving birth, I think it really shows that, you know, the council member is trying to hear what are the, you know, what are the issues, how do folks need, you know, the care, and then looking at it. So that's really, really, that was incredible to hear. Let's see, I know we have a few questions. I'm going to try to like bunch them up. I guess the one that was really interesting, I don't know if anyone has an answer to this. I wish Matt was still on. But one question is, how do you, one second. How do you figure out where candidates stand in terms of supporting people with mental health issues? I want to vote for people who will support me, but I have no idea how to find out who they are. Do any of our panelists have any kind of tips or tricks or any ideas of how can you find out where candidates stand when it comes to mental health issues? Or if audience members know, I want to put that in the chat, please do. So yeah, finding out who are your mental health champions, essentially. Any tips?
I'm listening very close.
Of course, I love it. Irving, we're gonna say
Yeah.
Okay.
Actually, yes. So in this fight to save New York Psych and the inpatient beds at my facility, that was one of the things that we needed to tap into. We needed to find out who were the elected officials who did take a stand on talking about mental health. We used the internet, but also more importantly, we spoke directly with the officers and asked, you know, where do you stand on mental health? What have you done for the mental health community in the past? And this is what we're facing currently. What is your answer, and what will you be willing to do? And we've had some people who were very upfront and, you know, said this is near and dear to my heart. Somebody like Brad Lander, who is our local councilman, he came to our press conference and spoke, you know, very passionately about where he stands on mental health. We also have, I believe it's Assemblywoman Frontes, who's in Coney Island. She's also been on the forefront and the front line talking about mental health. So my, you know, approach to that is using the net, looking at, you know, where the issue is and talking to the local politicians. I know Senator Jackson, Robert Jackson, who has been very instrumental in trying to keep New York Presbyterian Island Pavilion open. He's also been a huge supporter of keeping these beds open, but also getting more funding to target mental health. So that way that we can expand programs, and that way that we can provide communities and our patients with what is needed, especially at this time when we're seeing so much more need help. And, you know, that would be my answer to that.
Absolutely. That's a really good.
There's a quick follow-up question to that. What was that? Can you say the hashtag that you referenced?
So it was Save NY Psych. So if not, you can go on the NYSNA.org website. We should have a section up there right about now that talks about mental health and, you know, what we are trying to do. And in 2021, I will make sure that it's going to get done and talk about even more because it's certainly necessary now. But 2021, like I keep saying, is going to be a very huge political year in New York City and state. And we need mental health to be on the top of every politician's mind. And the only way that we're going to do that is if we demand that respect from the politicians and demand that they talk about this. So panels like this is excellent. And hopefully this won't be the last. And I look forward to working with NAMI-NYC, NY State on hopefully seeing some results in 2021.
Yeah, well, I forgot what I was gonna say, Irving, but as soon as you said hopefully this won't be the last one, I was gonna tell you Clara's on the call. So she has probably scheduled you for 2 more panels already. So okay, get ready.
No problem. No problem.
But yeah, I thank you so much for that answer. I was gonna something that we've talked about at NAMI New York City, and I think that NAMI New York State and NAMI National are trying to figure it out, is really creating a kind of a grading system for elected officials, so in addition to like what Irving said about, if you care about universal payer healthcare, so maybe like look up your elected official and universal healthcare, or, Googling, it's besides, just doing that kind of hard research of elected official plus issue and seeing what comes up. We're looking to see, or something that I think is in the works, is how can we make it easier so you can look up, Carlina Rivera. Okay, we see that she's doing all of this. Boom, here's her score, which I think, and we want, and just like elected officials, are trying to fight to have a high, reproductive rights score, or a gun rights score, or environmental rights score. They should be fighting to have a really high mental health rights score, So I don't know if it'll be done by 2021, like Irving is like trying to shoot for, but I hopefully it's done sooner rather than later, because I think it would really, really help. So now we're closing. We're at 7:25. So now, Clara, what were you gonna say?
There's one more question in the chat, which I think is potentially interesting for panelists, may spark some additional discussion. I don't know if you want to get into that, or if we need to wrap up for the sake of time. As the moderator, that's up to you.
Yeah. Is it Daniel Prude's case? How did Daniel Prude's? All right, I'm gonna kind of cheat and answer a little bit. That is a really good question. I would say that
for folks that maybe can't see the chat.
Yep, right. That makes sense. How did Daniel Prude's case affect the conversation in New York about mental health crisis response as a replacement to law enforcement responses? So, and for those who may not remember, Daniel Prude is the Black man who was killed in Rochester when he was having a mental health crisis. Police were called. He was apparently he was symptomatic, was naked in the streets, and they put what's called a spit hood, essentially. So, because they said police accused him of spitting, so they put this hood on him and then held his face on the ground, and he ended up suffocating. And this is up in Rochester. And it happened in March, but I think the footage just came out this summer. So how did it impact? It's a really good question. How did it impact crisis response? I think what it did was really, I think it really just further emphasized why police cannot be or should not be first responders for mental health crises. Because I think that sadly that story, Daniel Prude's story, was a really familiar story that we've seen with Mohammed Ba, or countless other names here in New York City, of folks who were having a mental health crisis, and rather than getting help, police were sent and they end up dying. And so one of the things that NAMI New York City is really focusing on is how do we remove officers as first responders from mental health crisis, as crisis responders. So ultimately they don't have the training for that. When COVID, and this is the example I like to think about, because a lot of people are like, oh, well, what happens if something goes wrong, et cetera, et cetera. They're our first line of defense. When COVID-19 was striking, we were not training police officers on how to measure temperatures. We were not asking them, okay, here's how you put a mask on right. We did not teach them how to do contact tracing. We didn't do any of that. We went totally towards our health system. We didn't do the best job, right? But we're building up a contact and tracing corps. We're not asking NYPD investigators to do that. We have a clear understanding of the difference between law enforcement and healthcare. And when you send cops, because cops handle law enforcement, right? They handle issues. When you send cops to mental health issues, what you're really saying is that it's a crime, and you're not sending folks with appropriate tools or training. Yeah, but that was a really, really great question. And I think I'm really excited to see how NAMI New York State and NAMI New York City get to focus on this issue. And yeah, because there's lots to be done. How can high schoolers get involved in mental health advocacy? That's a really tough one. I think the way you can get involved is by, I think, signing up on the NAMI listserv and signing up for other issue listservs, so then you can know what's happening. And then you can take the steps to reach out, because unfortunately, something I ran into at NAMI is we just can't really work with folks who are under the age of 18, unfortunately. I mean, for legal reasons, you can't work with folks who are under the age of 18, even though in some states, folks who are 16 and up can now vote. But that's not the case in New York. So I think if you're under the age of 18, it's about finding out what finding out what the issues are, and then if you can't work with a group, so organizing with your friends to like make calls and things like that. And then like Daris said, helping reduce stigma. So just talking about mental health in your own life, in your own situation is really helpful. You can reach out to NAMI New York City about ending the silence to your school. Yeah. So now it's 7:30. So what I want to do is I want to turn it over to our panelists. It's over. It's a little past time. So I would just really appreciate, one, thank you so much for coming, and thank you for giving us your time and your expertise. It was incredible. I would love just to hear from all of you. What are some ways, what's something that you would like to see, how can elected officials demonstrate that they are serious about taking care of serious about supporting folks living with a mental illness?
Like see the empathy to see the other person.
And I think for you, Katie, even though you are working, I think you can just say like some of the ways, if you want to talk about some of the things that the council members like excited to work on, even though you mentioned them, maybe just kind of going back over that. So, yeah, Daris. So I'll start with you, Daris. What is something you're looking for an elected official to show they're serious?
Right. So I would just like to say that I would like to see when I walk into an office of the local reps, especially that the staff is knowledgeable on language that refers to people with mental illness. I know I went in one day and I was asking about housing. I was having a conversation and one of the staff members said, "Oh yeah, the crazy people live down the block." So that to me showed me that they're not having those type of conversations in the office for whatever reason, and that's something that needs to be addressed. So it's coming, I guess it could be coming from the top down on how they think about mental illness. So if people are just made to be a little bit more sensitive around human beings that are suffering with this with mental illness, that would be really helpful. I would love to see that, and I would also love to see that in my community, they made pamphlets of all the things about mental health, but I don't see anything more than pamphlets laying around. So I would like to see a little bit more action when you put out something like that to show that, yes, we support this, we support mental health in our community by having activities around it and not just papers in offices.
Thank you for that, Daris. That was great. And I also gave it, if you can't vote, that was also another way you can get involved. So that was wonderful. Irving, please.
Right, so I think elected officials can show their support for people in the communities that are impacted by mental illness by not being afraid to speak up on our concerns. Also not being afraid to combat the stigmatization and overcriminalization of those with mental illness. Ensuring that bills such as Nicole's law, which Matt had mentioned earlier, is passed. That's a crucial law that will have such a positive impact with so many in across our country. And just ensuring that that's passed, ensuring that there's job protection for those that have mental illness, fighting on an even bigger scale to talk about the reimbursement value for providers, so that way we can encourage more to provide more services and not reduce it. Like we've been saying all night, the need is there. So we need to have providers on the ground and community-based organizations who are sticking up for those that suffer from mental illness. Having more nurse practitioners, psychiatrists, therapists, other advocates, such as NAMI as well, who continues to be the leading voice when it comes to mental health and what is needed for our patients and their families. I'll say this one more time, 2021 is gonna be a huge year. And I'm telling you, I feel with every fiber in my body that, mental health will be discussed. It will be something that is gonna be respected, and we will see some great changes. So thank you so much for this opportunity tonight. Have a wonderful night, everyone.
Thank you, Irving. All right, Katie, last but not least, how does Councilmember Rivera show that she cares about families, individuals living with mental illness?
Yeah, well, so hopefully she puts her money where her mouth is. I'm the budget director, so I'm going to talk about three budget initiatives. One is She contributed $3 million in capital funding to a project in the neighborhood called the Lower East Side Girls Club Center for Wellbeing and Happiness. And that's a community center that's based around mental health and wellness, providing a variety of services in the community. And they don't do, they don't have a fully certified a licensed professional on staff at all times, but what their aim is to have to just talk about it and to create, you know, sort of that wraparound service aspect. She's also contributed $750,000 in capital funding to supportive housing in the neighborhood. So a project that would have mental health services on site. She also spearheaded a $390,000 initiative to have transgender and gender nonconforming navigators in the health and hospital system, and passed legislation that requires all hospital department facilities housing transgender and gender nonconforming people to have access to comprehensive mental health treatment. We're pursuing legislation in the New York City Charter to amend it by removing the term mental retardation, which shouldn't be there, and substituting it with intellectual disability. And also pursuing legislation that would move the 911 unit out of the NYPD and create a mental health response team so that NYPD are not the first responders. And those are just, you know, some bullet points of things that we've worked on in the office. We're also looking, you know, at PsychR reforms. We also work on those Medicaid reimbursements, safe staffing levels, and hopefully we talk about it, and hopefully everybody can hear that we take this very, very seriously, and we're always open to new policy ideas. So please reach out to me if you have any questions or concerns or any policy ideas. I put my email in the chat, but I'm going to put it in again. You can contact me at any time. And, you know, thank you so much, Irving and Daris and Jamil, for sharing your expertise and sharing your experience, because I'm definitely taking notes, and hopefully we'll be able to partner on a lot of these issues moving forward.
Thank you for that, Katie. Katie brought the receipt. She's like, let me tell you what my boss does. That was great. Thank you so much. Yeah. And on that night, I absolutely agree with Katie. So thank you, Katie, Daris, Irving. Matt's not here, but thank you, Matt. Thank you, Clara and June. This was a terrific panel. I learned a lot. And I think that's usually my definition of a panel. How long was it, and did I learn a lot? And I felt like this one, it evened out well. So thank you all so much. Please go to NAMI-NYC.org for more events. And you can also see our helpline. You know, if you have any questions, you can reach out to our helpline. Again, NAMI-NYC.org is the best place for follow-up for events. We have upcoming ones as well. And yeah, thank you so much for this. This has been a wonderful, wonderful event. Just to end it, so thank you all, and I really, really appreciate it. Hope you guys have a great night. Take care. Bye.
Thanks so much, everyone, for being here.
Good night.